again, I forget, right? The patient had abdominal pain or something. And again, here's the pancreas. And then as you move through the pancreas, a very subtle lesion right here. And you can see very subtly that the lesion does obstruct the pancreatic duct. And it is, you can see that this is a very easy finding to miss, especially like if you're reading on the call quickly. This was actually, I'm sorry, this was actually picked up, and the patient was sent for MRI. Again, like I think T1 with FAT-SAT pre-contrast is like the #1 sequence, or like the first sequence you go to, at least I go to, see like little lesion. And you come here, kind of not quite here, but you can see that the pancreatic duct is dilated and it kind of stops right there. And then in this case, you can see that there is a lesion. It's not, it is hypervascular. You can see it's enhancing and just kind of blends in. And clearly much easier on MR than on CT. You can see it obstructs the duct. And then the duct is again very well seen on obstruction right here. And it just obstructs right here. So this is a hypervascular mass, right, which actually obstructs. So
hypervascular mass obstructing. So hypervascular lesions, I think about neuroendocrine tumors.
Right. So
what else? Mets, like RCCs and thyroids.
Right. So
we think it's a serotonin producing neuroendocrine tumor.
Right. So our first thought also was neuroendocrine tumor, although obstruction of the pancreatic duct is not quite common.
Mm-hmm.
But we recommended the EUS, and this was actually metastatic melanoma.
Mm.
I don't have
T1
much
bright
to say about metastatic melanoma other than it wasn't very T1 bright, but melanoma mets don't have to be bright. It depends on the degree of their how much melanin they possess.
Mm-hmm.
You can argue that in this case, the lesion was kind of iso to the parenchyma, right? And the parenchyma is relatively bright. Theoretically, like not theoretically, but like conceptually, right? This sort of brighter than what you would expect a lesion to be. So probably there's some melanin in it, but absence of T1 hyperintense signal doesn't exclude melanoma. But also you can see, and these are T1 hyperintense mets.
Oh, there's mets everywhere.
Right. So this was a met. So I couldn't really find anything in terms of like melanoma, specifically pancreatic mets. It just says very rare that it goes to pancreas.